Sir, તમે અહીંયા કેવી રીતે? કેમ છો?
Hi, Rucha,
So
how
good
are
to
you?
see you. I am good, sir. How are you?
I am fine.
After a long time. તમે
Long
કેવી
time.
રીતે અહીંયા આજે પણ?
Just relaxing on a Sunday.
Sunday afternoon? Okay. So this is Dr. Navin Patel. He is ENT surgeon, very senior ENT surgeon in Ahmedabad city. He has his own practice, Life Care Hospital કરીને છે અને બહુ જ અમારા લીડિંગ ENT સર્જન છે અમદાવાદના. એટલે બહુ જ આનંદ થયો આજે સર આપને મળીને.
મને બી. She is Rucha Mehta, and she's practicing as an endocrinologist, has her own clinic, and she has been working with Apollo Group also. So why not we sit down?
Sure. Long time we have not let's
Long
catch
time
up.
we have not catched up.
બોલો સર કેવું છે બધું કોવિડ પછી ને કેટલો લાંબો સમય બધું ચાલ્યું કેવું રહ્યું કોવિડ વખતે
has created a havoc. Actually, COVID created a havoc for an ENT surgeon with a problem of mucormycosis.
ના સાચી વાત છે બાપરે ભયંકર આટલું તો જોયું જ નથી વી હેવ નોટ સીન સો મચ મ્યુકોરમાઇકોસિસ ફોર શ્યોર
એટલે મ્યુકોરમાઇકોસિસ તો સુનામી હતું. ઇટ વોઝ અ સુનામી ઓફ મ્યુકોરમાઇકોસિસ.
તમે કેટલા ડેલી એટલે તમને કેસીસ આવતા હતા કે વીકમાં કેસીસ જોવા મળતા હતા અને પેશન્ટ શું કમ્પ્લેન લઈને આવતા હતા
રૂચા એકચ્યુઅલી ઇટ વોઝ અ ફ્લડ ઓફ પેશન્ટ્સ. પહેલાં છેલ્લા 20 વર્ષથી મ્યુકોરમાઇકોસિસ કંઈ નવું નથી, પણ એ વખતે કેવું હતું કે તમારી ઓપીડીમાં ધારો કે સવારની ઓપીડીમાં 30 પેશન્ટ આવે તેમાંથી 20 પેશન્ટ મ્યુકોર ના હોય, એટલે ઇટ્સ લાઈક અ ફ્લડ. અને એ એપ્રિલ મે જૂન વોઝ વેરી બેડ.
બાપરે
અને દે કમ વિથ ડિફરન્ટ કમ્પ્લેન્ટ્સ, દે કમ વિથ હિસ્ટ્રી કે મને કોવિડ થયું હતું, મને ઓક્સિજન ઘટી ગયું, 5-6 દિવસ મને આઈસીયુમાં રાખ્યો અને પછી મને નાકમાંથી બ્લેક કલરનું ડિસ્ચાર્જ આવે છે, મારા દાંત સૂના પડી ગયા છે, મારું જડબું બહેરું થઈ ગયું છે, કાં તો મારી આંખ લાલ થઈ ગઈ છે, કાં તો મને ડબલ વિઝન આવે છે.
અરે બાપરે
ભાતની વેરાયટી. કોમનેસ્ટ પ્રોબ્લેમ વોઝ લૂઝનિંગ ઓફ ટીથ, unbearable pain in the face or numbness of the face and double vision.
ઓકે અને આમાં તો ખાસ કરીને જેટલા બી પેશન્ટને સ્ટેરોઇડ્સ આપ્યા હશે એ લોકોને નહીં થયું હોય તો એ ફોન કોલ્સ તો બહુ જ હેન્ડલ કર્યા હશે કે મને હેડેક થાય છે, સિવિયર હેડેક એક બાજુ.
પણ સાચે કહું સ્ટેરોઇડ માટે મારા એન્ડોક્રાઇનોલોજીસ્ટ મિત્રો કરતાંય ફિઝિશિયન કલીગ્સ વર બહુ જ જવાબદાર.
અરે બહુ જ બધાને જ સ્ટેરોઇડ્સ આપવામાં આવ્યું છે અને હાઈ ડોઝમાં અને બહુ જ બધા દિવસો
વોટ ઇઝ યોર ઓપિનિયન? સ્ટીરોઇડ્સનો ઓવરયુઝ થયો એ ગ્લાયસેમિક એટલે કે ગ્લુકોઝ કંટ્રોલ કર્યા વગર થયો, એના કારણે આટલું બધું મ્યુકોર હતું, શું હતું તમારું?
ના સાચી વાત છે. સો મેઇન ચલો મ્યુકોર તો આપણને ખબર જ છે કે એ ફંગસ છે જે બધે જ પ્રેવેલન્ટ હોય છે, પણ એના કારણે મ્યુકોર માઇકોસિસ એટલે કે એનું ઇન્ફેક્શન થવું ને આ રીતના જે આપણે જોતા હતા કે આખા સાઇનસીસમાં ફેલાવવું, that is not going to happen unless you have also uncontrolled diabetes, some other immunocompromised disease, or you have not been taking care of all your other health. So this was happening. બધાને નથી થયું ને, કારણ કે કેટલા બધાને સ્ટેરોઇડ્સ આપ્યા. અમદાવાદમાં આઈ થિંક કંઈક આંકડો એવો હતો કે 1000માંથી 13 કેસીસ કે 13 આઉટ ઓફ 1000 કેસીસ ને થયું હતું, જે મહારાષ્ટ્રને બધા કરતાં વધુ હતું. યા એટલે ખબર નહીં આપણે ત્યાં
ગુજરાત ઇઝ કેપિટલ ઓફ ડાયાબિટીસ. એવરી 1 in 3 ગુજરાતી because of his craving for food. Guju food is known. અને ગુજુ ફૂડ
પછી તમે કેમ અહીંયા બેઠા છો? આપણે ગુજરાતી ફૂડ ના ખાવા જવું જોઈએ?
આપણે જવું જ જોઈએ. લેટ અસ ગો એન્ડ હેવ સમ ગુજરાતી ફૂડ.
અને આપણે વાત ચાલુ રાખીએ. The tea is amazing. I'm so glad you told me to come here.
Yeah,
I'm really loving it.
And don't forget about the fafda and jalebi.
I'm waiting. I've not had any lunch, so I can't wait to have. I love any Gujarati traditional food. That's really something
the
I
fafda
love.
and jalebi is a love for Gujus.
Okay.
But that brings in what? It brings in diabetes.
Yes,
And diabetes is where you people have made real mistake when we were handling COVID. You people created a mass. You did not control the glucose very well.
That's not right. That's not true. I think it was more that everybody was treating COVID. And there were so many patients, it was overwhelming. I mean, as you just said, there was a tsunami of mucormycosis, but before that, there has always been a tsunami of diabetes in Gujarat especially. Why 1 in 3 Gujarati, we say every third Gujarati is a diabetic and the remaining 2 are pre-diabetic. So there was always a higher
Yeah,
chance,
it was
right?
this pre-diabetic which were undiagnosed.
Yes.
In the COVID, they became diabetic.
Right, after
And they made them
steroids.
vulnerable to a COVID-associated mucormycosis.
But why do you still think, is it only the diabetes or was there something else that caused the Gujaratis? Why did they have so much COVID over here in Ahmedabad and in Gujarat in general?
The reason was probably a Delta variant. And we had a very wide prevalence of Delta variant in Gujarat.
Okay.
And we had a very bad COVID-associated mucormycosis. And the pathetic situations were they were coming in hordes. So all the ENT surgeons were doing to diagnose them were using three modalities.
Okay.
One was a nasal endoscopy and biopsy.
Okay.
The second one was CT scan and MRI of the sinuses and eyes and brain
Yes.
with contrast. You know, it was associated
Oh,
with
wow.
contrast.
Look
Wow,
at the
look at this, look at this.
That looks just fantastic.
Fantastic. There's the
Wow.
Fabra.
I'm gonna dig in, yes.
Yeah,
Absolutely. I love Mitri, so
yeah.
this is fantastic. Thank you. Any day. Yeah, so you were saying about how you were diagnosing them. Oh
Yeah,
my
look
God.
look at this Gandia and the this is a different variety. Rucha.
Oh, this is
Gandia and
Papda.
Papda.
Thank you.
Yes.
We'll need something sweet at the end also
Yeah,
to
we
make
will
sure.
have a jalebi. We will have a jalebi.
Oh, there you go.
There it is.
Thank
There it
you.
is. The jalebi. You know the jalebi is coming.
Wonderful.
So this jalebi is culprit. It converts the food pre-diabetics had,
Uh-huh.
and when they were in COVID, they were not eating well. So it created a situation known as ketoacidosis. You know ketoacidosis. Ketoacidosis is better than me.
No, we did see a lot of patients with uncontrolled sugars. And as you rightfully said, it was not just steroids. The COVID virus itself was causing a very high sugar.
Hi.
And then we've heard about this industrial oxygen use, many other factors, the pollution, lots of these things, that also triggered worsening of the mucormycosis, you think?
But the real culprit was that ketoacidosis. You know what mucor does? Mucor loves acidotic tissue.
Right. Okay.
And a pre-diabetic getting converted into, because of ketoacidosis, the tissues are laden with,
Okay.
and you have a little of nasal irritation or a break into the nasal mucosa, the mucor invades. You know, fungi
Absolutely.
had more right on this planet Earth than me and you. They came on this planet Earth first.
For sure. Yes.
And they will attack humans because we came and invaded their planet.
But it was ghastly. It was horrific to see when it was so
Horrible.
invasive.
See, we were removing teeth. So there were young people losing the teeth and jaw. They were losing the eyesight. We had to even enucleate the eyeball. Rucha, we had to remove the eyeball.
So here we are. This is the place I was telling you about. That ISKCON Gathia was nice, but this place is really has become very famous now because it was created by M.F. Hussain. He was tasked by B.V. Doshi, who is the greatest architect that India has produced. We are all proud as Indians. He's the first architect at this age, he's 80 plus, to have got the Pritzker Award for architecture. And why I know so much about him? Because we have a family connection. B.V. Doshi's house is built by my husband's grandfather.
Wow.
We were the biggest contractor. So B.V. Doshi's own house is built by my grandfather. Therefore, they used to work very closely together. Their offices were next to each other. So we have really, that's how I know about this place.
Wow. But we were talking about antifungals.
Yes. I thought this will be a nice location to continue our conversation.
But the antifungals were the mainstay of therapy for mucormycosis.
Correct.
And the antifungals, that is amphotericin B, and the one which needs to be given IV. So those antifungals are doing the maximum job in a patient suffering from mucormycosis. So the antifungal and its scarcity after the tsunami of COVID-associated mucormycosis was extremely
It created so much panic. People used to be calling me all the time, where should I go get it? Can you help me, doctor? Those phone calls were all night, right? We all went through that.
We went through all
It was
that.
crazy.
And that COVID-associated mucormycosis gave us three things. Disfigurement of the head and body and the mortality.
Oh, absolutely.
The mortality was 50% if a patient was untreated. So it leaved behind disfigurements, bad mortality, losing eye, spreading the brain, invariably fatal. So we had those kind of situations. Now the diabetes which created this, but diabetes is known for opportunistic infection.
Oh, absolutely. So during this COVID, it's not just the mucor. We talk about the mucor because it's rare. But at the same time, because our patients' sugars have become so uncontrolled, we are seeing an increasing number of foot infections. We are seeing increasing now in the post-COVID, lots of heart attacks, which may be COVID related, but also uncontrolled diabetes, Fournier's gangrene, empyema of the gallbladder, several skin infections, several other opportunistic infections, getting a pneumonia after this. If they get a simple viral infection, they can get really bad. So what becomes
Why
the
not
key?
malignant otitis externa?
Oh,
No, something which
absolutely.
affects
Of
the
course.
simple trivial scratching of an
course.
ear canal and they end up into a malignant otitis
Oh,
externa.
yes, absolutely. So I'm sure you see a lot more of that. So, and we hope not to miss it because we need to know all those signs and
True.
symptoms too.
But why don't we talk about how to prevent?
Yes.
Rucha,
so this is
you are the
key.
best person to tell this.
Thank you. And I'm a big believer that we don't want to treat anything, we want to try and prevent it. So of course, now that we know the few things that cause the flaring up of this COVID and diabetes and also mucormycosis was uncontrolled blood sugar, steroids, maybe the use of industrial oxygen, several other factors, overuse of steroids, and of course the cytokine storm. So just for a second, I want to talk about the immunity related to COVID. So whenever the COVID-19 virus affects us, we have two kinds of immunity it kind of triggers, the innate and the adaptive immunity. There seems to be something to do with COVID-19. Somehow our immune cells are not able to control the COVID
The
virus.
storm overpowers
Yes,
them.
we are not able to. Interleukin 6, we know of all of these cytokine storms that we see. Normally also a diabetic has lowered immunity, but in the face of COVID-19, even those antibodies were falling short. So what can help you?
Why don't we go this
Let's
way?
have a seat, yes.
Yeah.
What we can do is we can certainly try to control the blood sugar. So it's very, very important that we need to control our blood sugars. Whether you need to take medications, lifestyle changes, if necessary insulin therapy. But please, I ask everybody to be vigilant that you need to check your sugars. If you were given steroids, you definitely need to make sure, thank you,
Thank you.
that you are controlling your blood sugars very, very strictly. Secondly, not just diabetes, if you are obese, obesity also had the same impact on immunity. So we are asking people to lose weight. Now lastly, vaccination. This is key. We have to make sure that everybody gets vaccinated. If you haven't gotten your vaccine today, this is the only tool we have in India. Of course, and we need to
The
promote it.
COVID vaccine is the only way to prevent COVID-associated mucormycosis.
Okay.
Everybody should take 2 doses of vaccine. Vaccine is the one which will bring us out of this pandemic. So, vaccine, control of sugar, and the learning that we use the steroids judiciously.
Oh, absolutely.
With-
Because
with-
not everybody needs steroids. I think in the beginning we can understand in the first wave when we were not really clear what this virus is doing. There was such a huge panic factor that it's going to kill you. But now we know what we need to diagnose. We have ways of predicting who will go into a cytokine storm and who will not. So I think it's important to control what we can. And certainly that would be number one, your diabetes. Number two is if you have pre-existing conditions, make sure you get them checked. Number three, COVID-related thrombosis, heart attacks. So if you need to be on your cholesterol lowering medications such as your statins
The anticoagulants.
and also the antiplatelets and anticoagulants. So for sure you need to do that because you want to not just prevent COVID, but you also have to prevent other things, So
And a word about your management during the COVID, about your
Yes.
diabetes management.
So luckily we were able to put together guidelines for Gujarat. So we were working along with the Diabetes India Committee at Gujarat level, and for all the hospitals we released sort of standard management protocols.
SOP.
Yes, standard. Because when the patient comes in, you want to think of using insulin. Do not use oral medications.
True.
Initially there was a fear that there's this class of drugs called SGLT2 inhibitors and they might precipitate ketoacidosis, but that fear now has been put aside. The DARE trial
Right.
showed that dapagliflozin has been really good in patients with COVID.
True.
Now DPP4 inhibitors may have a special role because they seem to prevent the entry of the COVID-19 virus into the alveoli, into the cells. So we are really using DPP4 inhibitors also for our patients with diabetes. and if necessary, insulin, medications as you need, because the main goal is to keep your sugars under control by one way or the other. And hence education, awareness is key. Educating the patients, the clinicians, the physicians, all of that becomes key. So I think, well, here's something which can
Yes.
boost your immunity. So
Yes,
we
yeah.
have some pineapple and ginger in here.
Yeah.
And that can also boost your immunity, but I'm not saying there's any data behind this, but
Yeah.
certainly you can not go wrong with eating the right kinds of food and making sure you're staying safe.
Yeah,
So-
but as you said, vaccine, good control of diabetes, good control or management during the COVID. We should talk about something which our administration can do. The administration can really think about waves coming in, at least prepare for us, the doctors, for oxygen deprivation, or at least a logistic chain for oxygen supply, a logistic chain for antifungals. Otherwise, it's very heartless or painful to
absolutely.
see our loved ones dying without antifungal or lack of an
absolutely.
oxygen.
You never felt so helpless like you did during COVID when you got those calls and you had no hospital beds, no oxygen. You did not know where to go, and this was really a worse
Really,
situation.
as a consultant, me and you were helpless,
Yes.
and we were feeling really bad. That is the one that situation should be prevented. And what is the way out? Way out is vaccine. Average person on the street is not ready to vaccine. 1/3 to 1/4 of our population is still not accepting vaccine. Please take vaccine. That's the only way to prevent COVID, and COVID associated complications like mucormycosis can only be prevented if you're vaccinated.
Yes.
It will give you a milder attack of COVID so that you don't end up into a COVID associated mucormycosis, because COVID associated mucormycosis will come only and only if you have to use steroid or you are hypoxic or you have
Sure.
associated complications. So milder form will prevent you from getting COVID, vaccine will prevent you from getting the COVID in a bad form.
So what's interesting, I know just this is off topic, it's not very medical related, but I think as humans we are so resilient. We have forgotten that entire panic. Just 3 months ago, we were so scared of this virus. We were worried about, we were stocking up medicines in the first wave. In the second wave, I had people stocking up even, the liposomal amphotericin.
Amphotericin B.
And now that it seems like we have forgotten, we are not even ready to vaccinate ourselves. So we really need to keep things in perspective and keep this in mind and be grateful on a daily basis for what we have. And the least we can do for everyone around us is vaccinate ourselves. So I would really think that that's the key message for all of us.
True. And don't hoard the medicine. At that point of time, we had people searching for amphotericin B, and that amphotericin B was lying in somebody's cupboard. Don't. Please don't. And we want our people to be resilient, but we don't want to forget our bad scars. So let's together prevent diabetes, prevent or pick up early pre-diabetics. I think you have some word to add, pre-diabetics. How do you manage them?
Absolutely. So for pre-diabetes, that's like the big thing nowadays, is because they were the highest at risk, is we believe insulin resistance, which is this underlying common soil hypothesis, that it's not that you're not making insulin, you're making too much of it. And we know insulin is the triggering molecule now that triggers bad things in your immune pathway. It triggers the inflammatory pathway as well as the oxidative stress pathway. And this is causing people in the future to progress to diabetes, progress to cardiovascular disease. Your food that you eat also affects your gut microbiota. For example, something as simple as if you can switch from processed foods and saturated foods to unsaturated and whole foods, you will reduce intestinal lipopolysaccharide. This reduces your gut permeability, and so you don't have an endotoxemia. And you will switch from bad gut bacteria to good bacteria. So these are simple things you can do at a home level.
True.
So these are the things we try to promote. Weight loss, if you're overweight of about 5 to 10%, that's the simple rule. So this is good, and walking 30 to 40 minutes every day is a very aerobic activity. So walking is something you can do on a daily basis. So I think these are the few key messages to give people that get up and get going and start doing what you're supposed to be doing.
But don't forget the scars.
Don't forget the scars. Yeah. Well, that was great. I think we have to get going, and let's enjoy the last of it.
Hello friends, I'm Dr. Rajiv Kovil from Mumbai, and today two of my very close friends, Dr. Rucha Mehta and Dr. Navin Patel from Ahmedabad, took you all over Ahmedabad. We had tea, we had fafda jalebi, and we discussed a lot of science. Somehow in the second wave of COVID, we saw a very high incidence of a very dangerous fungi called mucormycosis. And what one needs to understand is that humans came on earth much later. Fungi and viruses had invaded earth much before. So we need to make a plan to be living along with all these organisms, whether they are viruses or fungi. But mucormycosis has caused a lot of storm across the globe, especially during COVID. And type 2 diabetes as well as type 1 diabetes is a hugely immunodeficient disorder. You can place it with probably patients who are on immunosuppressive drugs, transplant patients, immunodeficiency disorders. So these are very high risk patients, and type 2 diabetes is an immunodeficient disorder. Infection by itself is a complication of diabetes. So whether it's lung infections, whether it's urinary tract infections, whether it's diabetic foot infections, these are all complications of type 2 diabetes. And this time we realized that in COVID-19, mucormycosis could be a peculiar opportunistic infection in patients with diabetes. What are the forms of mucormycosis we have seen? Rhinocerebral and pulmonary seems to be the most common. Rhinocerebral, most of the patients would come with probably a nasal discharge, maybe some amount of lacrimation, but we need a very high index of suspicion because these patients may have this black eschar tissue in the nasal passage, and one may require to actually examine them. Patients will be much more toxic. These may be patients who may be on immunosuppressants, maybe on immunomodulators, maybe on steroids, maybe diabetes with diabetic ketoacidosis. So these are patients which we need to identify. The other group, maybe you may have pulmonary mucormycosis. Pulmonary mucormycosis, in the CT you have a peculiar thick walled cavity and you already have a lot of shadows because of COVID. Problem is that one should have a very high index of suspicions. Prompt diagnosis very important to prevent mortality and also prevent morbidity. Apart from all this, why do we need to treat this problem? Because there's a huge load of type 2 diabetes who are very high risk for COVID-19 and its complications. One treatment of mucormycosis is a multi-speciality thing. It cannot be treated by one specialty. And why we need to treat it? Mortality is very high. 50% with rhinocerebral and almost 70 to 80% with pulmonary, even in the best of setups. So a high index of suspicion, prompt probably referral to an ENT who could look at the nasal passages, send some scraping to the KOH mount, because you will require to see non-septate hyphae on the KOH mount to come to a diagnosis of mucormycosis. There are certain other tests one may need to do, but important in treatment, what do we do? Hydration is important, putting a central line is important, glycemic control, metabolic control, prevention and treatment of diabetic ketoacidosis is extremely important. We may have to give amphotericin B. We know that amphotericin B can have some nephrotoxicity, so liposomal amphotericin B. These are the things which is very important. But most important is to prevent, is to make sure we have a very high index of suspicion so we can catch mucormycosis very early. We can put remedial measures in place. We can reduce the high mortality with mucormycosis and prevent the morbidity due to mucormycosis. Thank you all for a patient hearing. I hope I have been able to give you some clinical strategy about diabetes, COVID-19 and mucormycosis. Next time we'll have two top KOLs again talking about another complication in diabetes and take it to a different city to explore that city. Thank you all.